Parents and carers of adult children with multiple disabilities often struggle to secure health care for them. Tonight, we meet the extraordinary doctors of volunteering their skills and time to meet their special needs. This report from Stephanie Dalzell and Emily Jane Smith.
I just don't know where to go. I don't know who to turn to anymore. We know our kids fairly well and we know something's wrong.
The quiet of Coralie McNamara's suburban Western Sydney home is often interrupted by her son Peter's cries of distress.
You know, you feel like crying yourself, and I do, I've had cries, because you think, what can I do to fix this?
Since her husband died 15 years ago, Coralie has been her son's sole carer. The 34-year-old has cerebral palsy and everyday tasks are challenging.
Wait for the verb to come up.
More complex ventures, like medical care, are almost impossible.
Sometimes you just feel so alone. You go to the medical centre and they basically ask me what's wrong, and I go, oh, well, I don't really know what's wrong.
After several years struggling to navigate the health system, Coralie is now heading to Sydney's Westmead Hospital with hope. Peter's booked in at a clinic run by a team of volunteer health professionals every few months.
Several of my colleagues really noticed that there was a bit of a gap in the health system in terms of heavily disabled people being able to access reasonable health care. We thought, if not us, who, if not now, when?
Anaesthetist Pete Smith is leaving home early to try to fill that gap in his own time. He set up the one-stop shop clinic in 2020 alongside rehabilitation physician Rummana Afreen.
Good morning, Peter.
Hey, how are you?
After noticing people with complex disabilities were turning up in emergency departments with otherwise preventable conditions.
It's enormously frustrating to see people having really simple problems like, tooth cavities, dental cavities, ears blocked, basic skin problems. It's really frustrating to see these basic problems not being really well addressed.
The clinic works like a medical production line and is unusual because it uses sedation.
Hey Pete, guess what? It's almost time to go to sleep, okay? Take it easy, bro.
This allows Peter to tolerate Botox injections, which relieves muscle stiffness. While he's under, he receives multiple checks from various experts, like a dentist, who examines his teeth for the first time in years.
You're doing a good job. Yeah, you're doing a good job. There's some minor decay.
By providing sedation, we make the examination and the treatment easier, and we make the investigation painless.
I'm sort of feeling relieved because I know that if I had to do all this on separate occasions, it's going to be under anaesthetic here and there and everywhere else, and that's more dangerous. So I think this is really good.
While Peter and his mum are new to the clinic, 24-year-old Zahra has been a regular for about 2 years. Originally from Iraq, her family struggled to find help after Zahra left the children's system.
Hey, Cheeky, did you knock my monitor off?
She has cerebral palsy and needs around-the-clock care, particularly at night.
تبلش توعى كل 10 دقائق كل 15 دقيقة وتصرخ.
But that one I can't change, that's all. Yeah.
Zahra previously received Botox with only an oral sedative like Valium. Several people needed to hold her still.
Hello, Zahra. I'm just going to have a look at your legs now.
It's a very different experience now.
When we started to do the sedation and injected Zahra, then for the first time she slept well and she was positioned well on the chair.
Yes. طبعا أكون أنام أكثر وأكون مرتاح وأعصابي كيف نقول من ناحية إنه بنتي مرتاح إنه نايمة وما متألمة ومن ناحية إنه أنا أشبع نوم
This clinic is fueled largely by caffeine, goodwill and bartering. The volunteer doctors here offer consults to other health professionals if they see their patients in this clinic in return. But it can't run on generosity alone, and the doctors are trying to secure long-term backing.
We know that there are so many other people who would benefit from this sort of service, and at the moment we're not able to reach those people.
The models of care that are needed are expensive models of care, and often we see few patients because their needs are so complex. And the health system hasn't grappled with that very well.
When you're a child and you're in the children's health system, you are completely wrapped in support. And then I turned 18 and it was literally like falling off a cliff into nothing.
Ellie Demarchelier has cerebral palsy and spent much of her early 20s in the ICU for severe seizures that needed specialist treatment.
I'm so privileged in this area. So if I am struggling to pull together a medical team, I can't imagine what it is like for someone with, say, an intellectual disability or psychosocial disability.
Each of the states and territories have responded to 730, arguing there are numerous initiatives across the country set up to deliver high-quality healthcare for people with complex disabilities. Federal Health Minister Mark Butler acknowledges barriers remain, with a national strategy aimed at improving that underway.
No needles. All finished. Promise.
While he waits for change, Pete Smith is determined to continue his mission.
These are folks who otherwise wouldn't necessarily have those health checks done, or wouldn't have those services done, wouldn't have that help. And yeah, coming out at the end of clinic is always a really nice feeling.